measures may cause some inconveniences, but we are appealing to you all for understanding. These directives are aimed at protecting all of us. We have observed that arising from the directives, some people have decided to sneak out of these areas and because if you happen to be infected unknowingly, then you have just transferred the problem to another area. What you have done is to promote the spread of the disease in this area that you have relocated to. And I want to address the measures that were taken, particularly in Eastleigh and in Old Town, Mombasa. I want to address my fellow Muslim brethren because they are the majority in these neighborhoods. Indeed, I want to start by wishing them Ramadan Kareem. This is the holy month of Ramadan. It is a month of worship, and generally when things are normal, it is a month that brings people together. But it is also a month that brings the best out of people. And this holy month, everybody strives to do the best that they can be in every way they can. And I want to look at this in the context of the pandemic that we are facing right now. You also know that in extreme difficult times, it is also the time that brings the best out of people. So we have an opportunity here to bring the best out of ourselves on those two fronts of the religion as well as the pandemic itself that faces us. And I want to narrate the hadith about Prophet Muhammad, peace be upon him, who said, if you hear that there is plague in a land, do not enter it. And if you are in a land and it is visited by plague, do not leave it. That is a real hadith that is there, and it is basically the cardinal principle in public health control of contagious diseases, that is infectious diseases spread through community spread. It's the basic principle. It is as if this principle was borrowed from the religion. And I want to say that if we look at this, it means the measures that have been put in place in these two areas are meant to prevent people, one, from moving out and spreading the disease. And remember, this is a disease that is new, that we learn something every day about it. This is not a disease that has clear signs that we can identify who's carrying it or not. It is a silent disease in many ways. We have kept talking about the number of people who are asymptomatic. They do not show any signs or symptoms of this disease, yet they are carriers and are shedding the virus. Under such circumstances, it is safe to assume that each and every one of us is infected. If we make that assumption, then we need to adhere to the only weapon that we have of controlling this disease, which is all the measures that we have been talking about. Social distancing, physical distancing, hygiene, wearing your masks, keeping to yourself and avoiding gatherings, staying at home when you can do that. Those are the only measures that will break the cycle of transmission. As I address these two areas of Eastleigh and Old Town, I want to appeal to everybody to please remain within these zones that have been marked as restricted areas of movement. We are aware that there are, since the announcement was made yesterday, that people are sneaking out in one way or the other and going to other neighborhoods, South B, South C, and others. As I started off by saying, this brings the best in us. Remember, with a silent disease like this, one can be a silent killer. By moving out, there are the chances that you will be spreading this disease to others. You may not know that you are a carrier, but we have been telling you, you must assume you are a carrier because of the nature of transmission of this disease. Therefore, if you are leaving a place that is already a high-risk zone and going to another neighborhood, you are spreading the disease. And that should be on your conscience. Equally, and I want to again remind you of the hadith that I mentioned. Equally, if you are in a place that is visited by the plague, you do not leave that place. If you hear there is a land where there is a plague, you do not enter that land. So, for those family members or community members who are welcoming those who are coming from the high-risk areas that we have earmarked, you are also placing yourself in danger. Placing yourself in danger by bringing to your home, even if they are your kin, people who may be able to spread the disease to you. We therefore are appealing again to those neighboring communities that may have kin and relatives within the earmarked areas, that when you bring in people who are coming from these areas, you are putting yourself at risk, and we want you to desist from that. Those who are within these areas, we ask you to please remain in there, because when you're in there, the health workers are in there. You will watch out for whatever symptoms. If you feel that you have any symptoms or need medical care, you will be able to contact the healthcare workers. You can call 719, and healthcare workers will come in there to attend to you, to test you, and to see what course of action that they will take on you. Yesterday, the CS also talked about the issue of quarantine. We know that initially people were a little bit reluctant to present themselves for the mass testing and even to report cases because of the fear that once you are positive, you are put in quarantine, and so are all members of your household. And then they were afraid also of the costs of that quarantine. The Cabinet Secretary yesterday made it clear that testing and quarantine costs will be borne by the government. Therefore, it is important that people do come out for the mass testing, because it is the only way that we can be able to fight this virus. When we know where it is hiding, that is when we can go in there and fight it. And the only way we can know where it is hiding is by coming out and being able to test. Eastleigh and Old Town have become hotspots where it is circulating within the community. As we continue with our enhanced targeted testing in other areas, and we establish a level of community transmission that now needs some further action, you can be sure that further action will be taken in these places as well. Therefore, if anybody has the notion that the restrictions placed on these two areas are by design, I think that is not the case. It is because they are hot areas that need to be contained, and the same will apply to any other area where our numbers show that some action needs to be taken. I'm therefore appealing to Kenyans to report to the authorities any persons who recently moved into their neighborhoods we should be our brother's keeper. To the residents of Eastleigh and Old Town Mombasa, I want to remind you that it should not be business as usual. The measures we outlined yesterday must be strictly adhered to, together with the other guidelines meant to mitigate this disease. Such measures include washing of hands, maintaining social distancing, observing high standards of hygiene, wearing of face masks, and sanitizing where possible. These are practices that will help to bring back normalcy in those areas. And I think the more we stick to these measures, the chances is the earlier we are able to get out of this problem. Let me reiterate the issue of truck drivers. As I mentioned yesterday, all cross-border truck drivers are required to be tested at the point of origin of their journey and obtain a corona-free certificate at least 48 hours before departure. This arrangement has been arrived at as part of an agreement between the East African Community members on COVID-19 protocol. So there will be reciprocal arrangements between the states, in our case here between, for now, Uganda and Tanzania, where the major traffic is, in terms of requirement for this corona-free certificate upon arriving at a border point. Let me now give you the statistics for the last 24 hours. Out of 632 samples tested over the last 24 hours, 25 people have tested positive for coronavirus disease. This brings the total number of those who have tested positive to 607. This number is growing, as you can see, and we must do all that we can to stop it from escalating. Fellow Kenyans, from this number, 22 are Kenyans, 1 a Ugandan, 1 a Tanzanian, and 1 a Chinese national. Distribution of these cases is as follows. 17 are from Nairobi, 2 from Wajir, 2 from Kajiado County, and 1 each from Mombasa, Migori, Isiolo, and Nakuru. Isiolo now becomes the latest county to record a COVID-19 case. This brings to 18 the number of counties so far affected. The cases from Nairobi are spread in the following estates. Eastleigh is again leading with 9, Kawangware 2, Parklands 2, Riruta 1, South Sea 1, Umoja 1, and Juja Road 1. The one case in Mombasa, and that's good news to see that we have picked up only one case in Mombasa this time, is from Likoni, while that of Nakuru is from Solai. The age range is from 8 years for the youngest to 73 years for the oldest. And in terms of gender, 21 are males and 4 are females. It's a pattern that we have seen repeat itself, more males than females. On a positive note, we have today recorded an additional 7 new discharges or recoveries. This brings the total number of those who have recovered from the disease to 197. I am equally saddened to inform you that we have lost 3 other patients. 2 are from Nairobi, while 1 is from Mombasa. This now brings to 29 the number of people lost to this disease. As I conclude, I want to inform you that the government has made plans to evacuate Kenyans who had traveled to India for treatment. I think when the measures of travel were put in place, we had a number of Kenyans who had sought treatment in India being held up there. The government has now made arrangements for their return. They are expected to land this evening at JKIA, and staff from the Ministry of Health will be available there to facilitate their arrival and their subsequent self-quarantine within their homes. If you recall, the Cabinet Secretary yesterday said that these Kenyans who are coming back from treatment in India will be quarantined in their homes under the supervision of their doctors. I thank you.
Town, ilikuwa ni muhimu kuhakikisha kwamba idadi kubwa zaidi ya watu inapimwa pale ili kuhakikisha kwamba mnafahamu ni kina nani ambao wameathirika na kuchukua hatua. Hivyo basi katika mtaa huo wa Eastleigh ni watu wangapi ambao mlipima katika kipindi hicho?
Citizen TV. My question is, according to a transmission chain report from the Ministry of Health, it shows that families are more vulnerable because majority of those who turn positive are from a family setup, say, caregivers, parents, and the outside public sensitization of public measures are taking or are bearing fruits. What are there protocols that the ministry intends to issue with regard to how families then can protect themselves? Because at night when you go back home, you find that you mingle with your family members and risk transmitting maybe if you have the virus. So are there protocols? Probably the DG can answer to that. And for the 25 cases you've announced today, how many contacts are on the radar of the surveillance teams? Thank you.
Okay.
My question is concerning the issue.
Can't hear that question, eh? We can't hear.
Okay, my
Speak
issue
up.
is about the cases in Eastleigh and particularly in Kawangware. In Eastleigh, there has been, before the cessation, there has been massive in and out movement within the place, particularly with the, several people actually shopping there. And according to the residents, they say that, okay, during the mass testing, some of the people, they were coming all the way from Pipeline and some other areas to go for the testing in such areas. Maybe do you anticipate, don't you feel that maybe some other people from other places might have actually carried the disease there? And also the case for Kawangware, majority of the people there, they do actually work in Kilimani. And according to them, why is the government not also carrying out the testing, particularly in the Kilimani areas, mass testing?
The issue, the DG, a month ago, you indicated that there are plans to put frontline healthcare workers in accommodation, perhaps in hotels or other facilities, to ensure that they don't go back home and put their families at risk. So far, how many have you managed to accommodate and where? And in terms of the samples that you're testing, over 27,000. In terms of individuals, how many are those? Considering that maybe I got tested, I turned positive, I did another test for me to be discharged. So from the samples, how many individuals are those? And from those samples as well, how many healthcare workers have been tested?
Okay, thank you. Nafikiri ile swali ya kwanza ilikuwa kutoka KBC, ambapo nataka kujua wale waliopimwa Eastleigh jana walikuwa wangapi, na nitamwachia DG atajibu hiyo maswali ya. Kwa upande wa Citizen, The question was, how do we deal now with family setting transmissions? Of course, yes, that's a very important question, and the DG will also speak to that. But what I want to say is that I began by saying that we must all assume we are infected and carrying the virus. And this becomes even more important if you are actually in a community which we are calling now a high risk or a hot zone. Isli and Old Town Mombasa qualify to be those areas where you know that it is circulating. Therefore, if you make that assumption, then you must take the necessary precautions to be able to prevent yourself even when you are in your home. You can exercise the hygiene that is required there. You can exercise social distancing. It is difficult times, and we have to do some very, very unusual things. So that is, I think, what we need to do. We need to be conscious that we could be possibly carrying this and transmitting to our fellow members. And then, of course, be, very vigilant. Watch out for any signs. If anybody is showing any signs, quickly be able to contact the health authorities so that that person can take care. The disturbing thing, again, we are seeing is deaths that end up being COVID deaths within the community. And that poses a very, very high risk of transmission within that family because, at a point where somebody is reached, gone through the process and has reached that point, you can imagine how much virus has been transmitted and passed on. So I will ask DG to expound on that one. The 25 who are positive today, what are we doing in terms of following up on all their contacts? It is standard procedure, and this is one of the key tenements of following up on diseases of this nature, is that you must do contact tracing. Each and every one of these 25 will provide information. We know where they reside. We provide information of their contacts. Each contact must be followed up. And there is a whole team here that does that day in, day out, 24/7. They follow up on every possible contact of any positive case. That is the means by which we are able to follow those chains and break those chains of transmission. So you can be assured that that is being done and it is being followed up on. I think the question, the third question about Isli, although I did not catch it well, but I thought it was alluding to issues about traffic, frequent traffic in and out of Isli, and also that the possibility of those who are testing positive in Isli not actually being Isli residents. Is that the question? Today I was some of the leaders from Isli were talking to me with the same argument, that these numbers are numbers of people who have come to shop in Isli and don't actually come from Isli. Even if that were the case, it may not be the case, but even if it were the case, it really makes no difference, because if you are present in a community and you are infected wherever you come from, you are transmitting it, isn't it? So it doesn't make any difference. The fact is that there is community transmission in these neighborhoods that is happening. And that is why we should deal with the facts that we have and find measures that will be able to contain the condition, and that is what the government is doing. I think the last question for the DG, so I'll hand over to him to respond.
Thank you, CAS Dr. Rashid. Let me start by just highlighting a few things which were not part of your questions. At the extent of appearing repetitive and monotonous, the question of deaths at the community level is a real concern to us. Yesterday we had deaths in Mombasa at community level, again a sign of intense community transmission of the disease. And we have seen a similar pattern now developing in Isili, where today we had a community death. And usually deaths that occur at community level are signs that these people have a severe form of the disease, therefore they are more symptomatic and therefore heavy shedders of the virus. Those who take care of them and those who are in close proximity to them are at a very high risk of acquiring the infection from them. Therefore, our appeal again, once again, is to ensure that if you feel unwell with any of the signs and symptoms of COVID-19, which we have clearly articulated here over and again, including cough, high fever, difficulty in breathing, then you need to call 719 so that our rapid response teams can quickly come to be able to attend to you. The issue of movement from areas where we have done what I could call segmental lockdown, of course, is basically transferring the disease in case one is exposed or one is an asymptomatic carrier from one place to the other. In the spirit of African brotherhood and sisterhood, of course, we'll welcome all our relatives and friends to stay with us. But at this particular juncture, that would be a mistake to make. And it is a mistake that we should not be making 50 plus days into the pandemic. As of today, we have 195 people admitted in various health facilities throughout the country. I'm glad to tell you that the patient who was on mechanical ventilatory support at Kenyatta University has been moved out of a ventilator, is able to breathe on his own. The 4 patients at Coast Provincial Hospital who are on supplemental oxygen treatment continue to do well. In fact, there is a time that the doctors and the nurses can be able to wean them off oxygen and check their oxygen saturation. If it goes down, then it is reintroduced. We are seeing new foci of infection, especially now what is happening in Migori and Wajir, where we are dealing with imports from the neighboring countries. That is the United Republic of Tanzania and Somalia. And we are trying to put measures into place, despite the porosity of our borders, to ensure that anybody who comes through the informal border entry points, then the communities become our gatekeepers to be able to alert us. And such people can quickly be moved into quarantine, like what happened in Mugori. The 2 were quickly moved into quarantine, tested, and turned positive. For the testing that was done in Isili yesterday, the number went down a bit. It went down to 230 out of this number that has been reported today. However, based on how the disease, evolution of the disease, we will be able to mount another targeted testing based on the results that come out. Leto of citizens asked about family. Yes, family, especially family with young children and youthful population. You remember last week on Saturday when we did a presentation in 7th floor, that age group of 15 to 39, who even despite catching COVID, none has died. But these are very good people are transmitting the disease. So it is imperative that at a household level, we continue the infection prevention control measures. The hand washing, the use of the sanitizers, use of masks, especially if you're not able to maintain physical distance at home, then it is imperative that we continuously use our masks even at home. And of course, the infection prevention control measures must also extend to the other areas in the house, including our seats and chairs, the toilet facilities, and also all other linen that we use. Avoid sharing of linen in case you are so many in a house and it is literally practically impossible to maintain physical distancing. Then these are some of the measures that you could quickly deploy to avoid getting infection or transmission of the infection. Haemba asked question about why we should not be able to test people, do targeted testing in Isili. Remember, when we do the testing, it is based on contact tracing, and we only go towards targeted mass testing if you are not able to map the contacts with the cases. If you can be able to develop that contact tracing tree clearly, then you will be able to get to the last contact, and therefore it would not make economic sense to do targeted mass testing in that particular place. There was a question about healthcare workers. Remember, in the targeted mass testing, healthcare workers were prioritized as a high-risk group. I know Kenyatta National Hospital has tested all the frontline healthcare workers, both in the main campus and at Bagadi Isolation Unit. Same to Kenyatta University Teaching and Research Hospital, and also Moi Teaching and Referral Hospital. Equally, Coast Provincial Hospital has done that. And out of this, both in public and private health facilities, we have 30 healthcare workers who have been exposed. Indirectly, meaning they are not directly taking care of a patient. Even a healthcare worker, of course, can visit a sick relative, and therefore, through the contact tracing, you could be able to map him or her to a particular contact, and also directly. And I think it is only last week where we told you that a particular hospital in Coast region had a significantly higher number of healthcare workers who are exposed. And in liaison with the county health management team of Mombasa, we are quickly able to design a sensitization protocol to be able to bring them up to speed with the measures that they need to take as they offer services to COVID-19 positive patients and others. So we'll continue to test healthcare workers, and I think Kenyatta National Hospital and Bagadi have had more than 2 rounds. The teams at the Emergency Operation Center, those ones are strictly tested every 14 days. And if you're not tested, then we will not be able to send you out for a mission to be able to do contact tracing or pick a case to bring to the isolation unit. Thank you.